Hello, I'm Dr. Jim Mandell, the Chief Executive Officer of Children's Hospital Boston. I'd like to talk about the positive impact that Children's has on our community, our state, and the country, and explain more about our nonprofit status as a charitable institution. Increasingly, the public wants assurance that it's getting the value it deserves for granting organizations such as Children's tax-exempt status. Nationally, 95% of all major academic medical centers have nonprofit status. Being a nonprofit hospital allows us to focus on mission as opposed to quarterly financial results. In the 140 years of our existence, we have worked tirelessly to provide the highest quality care, lead the way in research and discovery, educate the next generation of healthcare leaders, and enhance the health and well-being of the children and families in our community. I'll talk a little bit about each of these missions individually. On the clinical side, we take on the most challenging of the challenging cases. Our case mix index, a measure of intensity of illness of the children we care for, is 75% higher than the in-state average. And nearly a third of our patients have 5 or more diagnoses, which is twice of the entire state average. We are also an essential safety net hospital, caring for more children from low-income families in Massachusetts than any other hospital in the state. In the fiscal year '08, we lost $23 million serving patients covered by Medicaid. And while our clinical care is the most advanced in the world, we have also established the largest pediatric research institution in the country. Much of this work at the bench and at the bedside is supported by private philanthropy and the taxes we don't pay. As the primary pediatric teaching affiliate of Harvard Medical School, we have always embraced our role as a training ground for generations of pediatricians and pediatric subspecialists and specialists. The graduates of our training programs go on to become leaders in the field, here at Children's and around the country. Caring for and supporting the families in our local community is also incredibly important to us. Today, more than half of the children requiring hospitalization in Boston depend on Children's. Besides the care we provide at the hospital, Children's also goes into the community to deliver services. We license and operate the Martha Elliott Health Center in Jamaica Plain, which provides primary and specialty care to children and families. And we partner with health centers, schools, community-based organizations, and city and state agencies to offer programs that focus on prevention and treatment, especially in the areas where there's a strong community-identified need, like asthma, mental health, fitness and nutrition, and injury prevention. In 2008 alone, Children's provided $39 million in community benefits as defined by the Attorney General's office. We believe Children's Hospital Boston is an essential part of this community and the country as a whole. We've done a comparative analysis of the benefits we give back to society and the potential tax liabilities if we were a for-profit hospital, and found that we actually provide significantly more in care and services to the community than the taxes we would pay as a for-profit institution. We don't take our responsibilities lightly. We feel proud that people put their precious gifts in our hands for safekeeping. And we work every day to repay that trust by striving to improve on the status quo, challenging the boundaries of medicine, and devoting ourselves to improving the lives of children everywhere. That is why all of us at Children's Hospital Boston are proud to be part of this great institution. Thank you.